period. You have to have an event. It could be, you could see it first person, that means you could be in it, you could witness it, watching a burning building and hear someone screaming, or you could even be told about it, which is the source of vicarious traumatization for social workers and people. The event has to have meaning to you. It has to generate an emotional response. This is, and the only way you generate emotional responses, as has already been mentioned, you have to have attachment. Inescapability. You have to be perceived for a moment that you are stuck. It's an inescapable moment. And finally, the most important thing is the landscape of the brain, which I mean by that the electrochemical landscape of the brain at the time of the event. And what that means is that not everybody who experiences exactly the same event will become traumatized. And that's because they have different landscapes. And the different landscapes accrue from different vulnerabilities and resilience, previous experiences, and the like. So, traumatization, and this is important, traumatization at the neural level is the process, and if you have a question, I'll explain it later, that permanently encodes, and we have all the neuroscience worked out, permanently encodes and synaptically consolidates linkages between the emotion state, fear, and the cognitive, autonomic, visceral, and somatosensory components present at the time of the event. That means everything that happens at the time of that event, if it gets encoded as a traumatization, it will be there for the rest of you. That's why smells and sights and sounds and everything that's around you, even words that are spoken to you, can be encoded at exactly the same time if the event is encoded as a trauma.